we have all these great number of pharmacists who are of better quality now, and there's this spread of pharmacies across the country. How are we integrating this quality and number of pharmacies and the spread of pharmacies into the mainstream healthcare delivery? When Kwame was talking, he talked about, for example, non-communicable diseases. And my brother from GMA talked about
the Vice President, Dr.
Proactive screening and identification of cases. So people don't go to a health facility until they have some sort of deformity or some pain. So somebody can be walking around with high blood pressure or high glucose, and there's no symptom yet because there's no complication. But we have to be proactively looking out for these people. One way that we can do that is to be able to ensure that we integrate pharmacies with pharmacists in there into the health system, such that anybody who comes to a pharmacy would have either a blood pressure check or, depending on the risk profile of the person, a blood glucose check. And because of that, we can proactively identify these people and then link them up or refer them to the health system where they can manage their conditions. So that's number one. Number two also is that should every health condition be taken to a hospital, for example?
For Dr. Tinkran or for NS York?
Exactly. Where are there some conditions that, based on now the training of pharmacists and the availability and the proximity of pharmacist communities, we can say that this scope of conditions will manage them at the community pharmacy level. And this is not something that is novel. In some other countries like the UK and other places, there are specific conditions that are managed at pharmacy level to decongest the health system, so that people who actually need that health professional will then have access to the person and not go to the facility and wait for several hours just to see the professional, because other people whose conditions could have been managed at the pharmacy by these health professionals could have been managed. So our number one proposal to the political parties has been the integration of pharmacies into the primary healthcare system.
And very briefly, how are you proposing to do that?
So first of all, the Ghana Health Service has recently launched what they call the networks of practice. The networks of practice is that in every community there's a health center. So that health center is going to be upgraded into a model health center. And all other health facilities, smaller health facilities in that area will be linked to that health center. And that health center is supposed to provide technical support and then operational support to these facilities. So pharmacies in those areas, the pharmacies should be included in the networks of practice and be formally linked to that system, so that when somebody comes to the facility and is screened and there's a need to refer straight away to the health center. That's number one. Number two is that all the pharmacies should be linked up in a digital system.
Okay.
You understand? Because in non-communicable disease, you also want to be able to longitudinally manage your patients. So it's not just a one-time touch and go. Yeah. So this person comes to the pharmacy today, checks a BP, and it's a cinema, goes to the hospital, is on a medication or whatever it is. But periodically, you can come to the pharmacy and then check their blood pressure again to see where they are in all those times that the blood pressure is being checked. There should be a system where that record becomes available to the health facility.